You're listening to the Women in Medicine Badass Radio Show with Dr. Sharon Grossman, episode number 9. Welcome to the Women in Medicine Badass Radio Show, where we deal with the real issues to get you from overwhelmed to optimal. And now, your host, Dr. Sharon Grossman. Hey there, all my Wimbas. How are you doing today? I'm super psyched because I found an incredible article that really outlines the culture of medicine, and that's our topic for today. The reason I wanted to talk about culture as it pertains to the medical field is because cultural misfit is one of the reasons people burn out. So I'm going to share with you 6 examples from the field, and I want you to consider how this applies to you and how the way you work can perhaps be improved to avoid burnout. Here we go. The Mayo Clinic divides culture into 2 parts: the culture of the organizations and healthcare system and the professional culture. So I'm going to share with you what they wrote as it pertains to values and behavior and the incongruity between the two. And if you're interested in looking into this more in detail, I will provide the link to the article in the show notes. When it comes to the culture of the organizations, there is an espoused value that we have that if you are a physician, you are a professional. So by default, we trust you. But the truth on the ground is that we also expect you as a physician to get pre-authorization for procedures and often excessive documentation to justify billing and prevent malpractice suits. So in effect, the practice is stating that we don't really trust you. Now, whether you feel this directly or not in your practice, I've spoken with enough physicians to know that the mere volume of paperwork is what drives so many of you to burnout, even if you feel trusted. But when you feel like the organization lacks trust in you, that in and of itself can lead to burnout because it messes with your mind. Let's look at some other examples. In terms of espoused values, we might say that because physicians are highly trained, their efforts should be maximized. It's like we say in business, you have to know what your time is worth and what you can do that nobody else can. Then you outsource the rest out so you can focus on getting the biggest bang for your buck. But in effect, what's happening is then we give our physicians clerical work, which is an ineffective use of their time. Now, I know this hasn't been done, but just imagine how much more money health organizations can make if they hired assistants to do all of the clerical work for their physicians. You can then focus on seeing patients and someone else would do the paperwork. This isn't such a crazy idea. We've hired nurses to take on some of the work from physicians. I've been to the doctor's office enough times when a nurse took my blood pressure, weighed me, and wrote down my height before the physician ever came in. Why couldn't we do something to help out with the clerical work? Just an idea. In essence, this practice is saying that your time is not valuable. Crazy, right? Let's look at one more. Here's an espoused value you can get behind. High quality care is our top priority. Sounds amazing, but here's what happens in reality. The delivery system in health organizations drives fatigue and burnout, which erodes quality of care. This spells out that economic priorities are more important than quality. Secondly, when we focus on relative value units, volume, or net operating income, which is how healthcare in America is run, we are essentially commoditizing both physicians and patients. Just the other day, I was telling my husband the story of how when I was a teenager, my mom was home alone with my younger sister. She took scissors to open up a package that arrived in the mail and accidentally rammed the scissors straight into her hand. She did the best she could to bandage her hand and drive herself to the hospital, but they wouldn't see her until she filled out the paperwork. I asked my husband, can you imagine having to cope with the pain and the blood while filling out forms? Not only is this challenging, but I would find it quite frustrating. But that's the world we live in. Now, let's look at some examples of professional culture and then congruence between the espoused values and the actual practice today in healthcare. Here's one. We all know that self-care is important. It's a universal value. But in practice, physicians and nurses are expected to work excessive hours, sometimes for long shifts, and then don't take care of themselves. They aren't eating well, exercising enough, sleeping adequately, etc. The implication is that self-care is not important and that short-term productivity is more important than sustainability. That's huge. I'm going to repeat this. Self-care is not important, and short-term productivity is more important than sustainability. That just captures it. So if you're falling into this trap, I want you to take this opportunity to reevaluate what you're doing and why. You need to align with your values and focus on the long haul so you can keep doing the work that you love. Second example. We all know that to err is human, but so many of the women in medicine I talk to are perfectionists. It turns out the professional culture is one of perfectionism, lack of vulnerability, and low self-compassion. Medical employees often hold the belief that mistakes are the fault of the individual and are unacceptable. What this really means is that physicians are expected to be superhuman and that we have not yet internalized many of the lessons of the quality movement that errors are inevitable in complex systems. In other words, you have to be realistic in what's possible. Don't try to be perfect. Have more compassion for yourself as you would for a friend or even your patients. You are human just like they are. I'll leave you with one final example. Fatigue impairs performance. This is a fact. It makes sense. I see this a lot with burnout clients. They experience mental fog and their productivity goes way down. And even though we understand this fact, we often drive ourselves to work excessive hours and often work until we become ill. As a side note, sometimes our body conks out on us as a way of saying, slow down. Notice that when you have the flu, you get in bed and do nothing. This helps you build up your immune system because you're getting the rest you need. Don't let this happen to you. Don't wait until you develop an autoimmune disease, have a heart attack, or worse. Take a look at what's happening in Japan, where workers are dropping dead from accumulated stress. Come back to the idea of work to live, not live to work. In effect, by working too much, we're saying that we don't believe this adage applies to physicians, or we are too arrogant to admit it does. This is plenty of food for thought. Now, I want you to consider what you might want to do differently so that you can avoid burnout. Don't forget to share your comments with me. And speaking of stress and burnout, I have just the thing for you. I put together a mindset mastery starter kit on my website, drsharongrossman.com. It's got articles and videos that address burnout, anxiety, stress, imposter syndrome, self-sabotage, and much more. So check that out and join my tribe to thrive. I'll see you on the inside. Thanks for listening to the Women in Medicine Badass Radio Show. If you loved what you heard, join my tribe to thrive. It's a free community where you'll receive daily tips and weekly trainings to optimize your life. Go to drsharongrossman.com to sign up. I'll see you on the inside.